Hello, this is Dr. James, a biomedical neuroscientist, and welcome to the Holistic Coach's Corner. So today we're going to talk about dysthymia, coping with chronic depression, plus 7 mood boosters. Dysthymia, also known as persistent depressive disorder, chronic depression, or dysthymic disorder, is a long-lasting form of clinical depression and it often lasts for several years at a time, with symptoms coming and going and changing from day to day and also week to week. Many people with dysthymia or dysthymic mood can benefit from both talk therapy and medical treatment. With changes to lifestyle and a strong understanding of what helps you personally cope with dysthymia, you can also use natural approaches to boost your mood and to manage your symptoms. What is dysthymia? Dysthymia, also known as dysthymic disorder or persistent depressive disorder, is a type of depression that is continuous and long-lasting or chronic. It used to be considered a milder diagnosis than major depression, but it is now known to have serious impact on people's lives and their ability to function normally. The condition affects 3 to 6% of people in the U.S. Dysthymia often starts in childhood, adolescence, or early adult and can last for years at a time. It puts people at risk for other personality disorders and substance abuse and can cause problems with relationships, school, or work, and day-to-day activities. In adults, dysthymia lasts for 2 or more years at a time. In children, it lasts at least 1 year. People with dysthymia have fluctuations in how they feel. They may not always be so depressed they can't function, but they do often have symptoms of depression that can make it hard for them to enjoy activities or feel good about themselves or their lives. At any given time, the symptoms may be mild, moderate, or severe. People with dysthymia may have breaks in the depression mood, or these breaks don't last longer than 2 months at a time. Dysthymia versus depression or other types. Unlike seasonal affective disorder, or what we call SAD, which comes and goes with seasons and also has variations of intensity, dysthymia does not depend on light exposure and time of year. Major depressive episodes can happen in people with dysthymia. However, these episodes are shorter than dysthymia, often severe, and typically require separate or additional treatment. When someone with dysthymia has an episode of major depression, it is called double depression. Postpartum depression is a type of depression that sometimes occurs after a woman gives birth. It may share symptoms with dysthymia, but usually does not last as long. However, dysthymia can begin around the time of childbirth, called peripartum onset dysthymia. Dysthymia can have different features in different people, including symptoms of anxiety, melancholy, psychosis, and more. Signs and symptoms of dysthymia. Symptoms of this disorder are similar to the signs and symptoms of depression. In general, to be diagnosed with this particular disorder, you must have these dysthymia symptoms: depressed mood, feeling down and uninterested in regular activities for most of the day or most days, lasting 2 years in adults and 1 year in children and adolescents. Irritability may be more prominent than depressed mood for children and adolescents. In addition, you must have 2 or more of these symptoms: poor appetite or overeating, sleeping too much or not enough, feeling very tired or physically exhausted, low self-esteem, not being able to concentrate, trouble making decisions, feeling hopeless. As with other types of depression, you may also have excessive anger and irritability, feelings of guilt or anxiety, or a desire to avoid social activities, and a decrease in productivity.